Hi everyone, I'm Steve Madden. I'm the GM of MM+M, and I'm here at the Cannes International Festival of Creativity, the Lions, in what is usually sunny Cannes, but today it's absolutely pouring rain, which makes it all the more special that my guest was able to get here through the raindrops. My guest is Gillis, the CEO of VMLYR&R Health, and I'm so glad you're here. Thanks for coming.
Thanks very much for having me.
So, Claire, you've been in the Palais, which is directly behind us, and you've been talking about health equity, which I understand is a particularly passionate project for you. Why? What is it about health equity that stirs you?
Well, I think it's really exciting for us all to be working in health at the moment. You know, there's never been a better time. The way the world has exploded behind better healthcare for all of us since the pandemic. And I think probably now that we've got the recognition, what we need to make sure is that we get that equitable bit so that everyone has great access to the right drugs, the right doctors, the right care, so that we can, I mean, it is a basic human right to have great healthcare. That's my perspective. So I think, you know, we're very fortunate that in Cannes they're starting to recognize that too.
Yeah, the pandemic really exposed a lot of the inequities that we're seeing, and I think it's really interesting that you've made this a focus for the work.
Well, my background is as both a scientist and a health economist, and this is just kind of the natural extension in working together with some amazing people from lots of different areas. So creatives, strategists, people who do experience, connections, and I'm pulling that all together into something that can actually really change outcomes for patients in the end.
It's also changed outcomes for your firm because VMLY&R Health is number 11 with a bullet on this year's Agency 100. You know, you had a phenomenal growth rate in 21 of 82%. What's behind that kind of growth?
Well, I think VMLY&R as a company is unique for many different reasons. The health team have come together in the last year and really focused on the prize. And actually the prize is phenomenal work. And when you do great work with great people, you know, great things happen. So I don't think we specifically set out to be in the top 11, watch this space, but it kind of came together and it was a great byproduct.
Mm-hmm. There are certain things about the culture at your firm that I think, to an outsider at least, look as if they might be driving these results. Can you talk a little bit about the pro bono work that your employees do?
Yeah, absolutely. So VMLY&R as a whole have one day a year where they get to work on any charity that they want. In the health team, we've decided that in addition to our normal, because we do pro bono work for patient groups and foundations and charities, we focus all of our people in that one day in giving back to patients. So right from our team in China who spent the day in a children's hospital, you know, even if it's just reading to the kids, that sort of thing, right, to initiatives over in the UK and the US. We worked on a business case with Duchenne UK to be able to make sure they got funding. It doesn't matter where you sit in the organisation, there is an opportunity for you to spend your day doing something that makes you feel really good, and it does make us feel good, and I think that's part of the culture.
So that's true patient centricity.
Yeah. I mean, for our work, we always put patients at the centre. Whatever campaign we do, we bring that in, and some of the work that we've seen here that's been so successful have patients at the centre. But this Foundation Day is just an amazing opportunity to work with your colleagues somewhere different without a client in the room.
Right.
You can just really go for it.
So what do you think the future holds for VMLY&R Health?
Well, I'm hoping we are going to shoot further up that league table, up the MM+M league table. And to do that, we have to carry on pulling those great people together, focus towards our outcomes. And I hope, honestly, Steve, in 3 years, I hope we're not talking about equity and diversity, because it's table stakes then.
Right.
And it's not unusual, and we can just focus on doing the great work.
I agree, and I hope we get there. I think
Thank
we
you.
will.